Feedback-informed treatment is something you can use along with any approach to therapy that you're using at the time. It's simply kind of getting the client's feedback. First of all, you need to know where somebody's starting from before they've even started the process. But then in the future, you see, at the end of a session, somebody can feel a sort of almost what we could say an artificial high. They've talked about it, they've made some decisions, they're going out there to do something different. The real test, though, is when they come back next time, how that's gone over the last week, 2 weeks. So that's the first thing it is. The other thing it is finding out from them how they are experiencing the alliance with you as the therapist. Because what all the research shows is that the most important thing the counsellor or therapist really does is establish that link, that relationship, that alliance with the client. And if we haven't established that, then whatever we do isn't going to help. Did you feel heard, understood and respected, or didn't you? Did we talk about the things you came to talk about, or didn't we? Did you feel maybe that I hijacked the agenda and we didn't end up talking about what you came to talk about? And if the client the feedback from the client suggests, well, yes, it could have been more helpful, yes, you didn't quite understand what I was trying to tell you about this, or you waffled on for too long about something else that I don't really think is that important, then we'll say, well, okay, we'll take that on board and we will be flexible, we will change this for next time. The studies generally have shown that over all areas of therapy, getting feedback like this improves the effectiveness of the service. People will embark on the journey of counselling, we will embark on any journey if we need to have some idea that we agree on the destination. What are we actually aiming for here? What will tell us that this has been worth doing? If we can roll it out, then two things that could happen are this. First of all, counsellors themselves will be much more clear in their own minds, I think, when they're actually helping people and when they're not. And they'll be much better able to maybe say to people who are thinking of coming in and using the service, or maybe to people who are funding it, well, these are the kinds of success rates we get.